Welcome back to Ask the Educator, a podcast for all professionals involved in medical device processing and sponsored by Healthmark Industries. The education team here at Healthmark has 280 years of combined experience in areas ranging from sterile processing, endoscopy, OR, biomed, to hospital and industry leadership. Our goal is to leverage our collective experience to answer one of your questions each episode, giving you the practical tips you need to succeed in the evolving world of device processing. My name is Kevin Anderson, clinical educator here at Healthmark, and I will be your host. Let's get started. Hello, everyone. This is Kevin Anderson, your host for Ask the Educator. For this bonus episode, we are doing something different. The pandemic that had some very interesting effects on our industry has brought up the subject PPE. It's really been brought to light during this pandemic. And that being said, we wanted to bring in someone with real world experience and perspective on this topic. So today I have the pleasure to introduce Jackie Daley. She's from Mission Hospital in Mission Viejo, California. She's a senior manager for infection prevention, and she is a certified infection preventionist with over 30 years of experience. She also does speaking engagements, independent consulting. She co-chairs for AMI working groups on ethylene oxide and water quality. And I'm just really excited to have her. Jackie, just thank you and welcome to the show.
Thanks, Kevin. It's my pleasure to be here to speak with other colleagues in the field of infection prevention. So thanks very much for the invitation.
Absolutely. It's a pleasure to have you. And just to sort of get us started, Jackie, if you would, just please share some of your experience from the front line regarding PPE.
Yeah, I will try to be brief because, the pandemics seem to have started so long ago, but when you really look back, it's only been a few months. And so, but it feels a lot longer for those of us dealing with it directly at the front lines, if I may use that term. And it has highlighted in a very significant way the importance of infection prevention, because this is, of course, an infectious diseases pandemic. So, and I think with this pandemic, it has highlighted a lot of practices that were considered maybe not okay in the past, but has really opened eyes as to how we use personal protective equipment, how we manage the supply of personal protective equipment, and how we need to change the way we work, the way we use those personal protective equipment. And when you look at that upside down triangle, the hierarchy of control, the PPE is at the bottom of that upside down triangle. But as infection preventionists and those healthcare workers, the nurses, the physicians that are at the front line, we don't think about the issues above, the engineering control, elimination of the risk and all that. All we see is that we are at the front line dealing directly with patients who may or may not have COVID. So PPE is a big deal for them. And because this was a novel virus and we didn't know exactly what the actual mode of transmission was, we were relying on guidelines and evidence from what was happening in China and in Italy and other countries across the Atlantic to kind of learn from what was happening there to ensure that what we did here was learning from any mistakes that they may have had to make sure that we would avoid some of those pitfalls. But I think as time went on, we realized that some of those pitfalls were not just related to the use of the PPE, but the supplies of the PPE. And many hospitals, systems across the United States have been stockpiling as in the event as part of their emergency preparedness plan to stockpile PPE, whether it be gowns or gloves or masks or respirators or PAPRs to ensure that we would be ready for a surge of infectious patients. And I think most of us were, but I think this kind of caught us up by surprise. Even though we were monitoring what was happening, we weren't seeing a lot of patients initially, but then we were starting to see exponential growth of infected individuals, which led us to opening our incident command center and implementing our systems within that structure. And so for those individuals at the front line, as I said, the PPE was a big deal because some of that use of PPE was being driven by fear, because we were hearing that another 100,000 people, when you look at it globally, had died, and the infections were multiplying and growing and growing. And so along with that exponential growth of infections came the exponential growth of fear at the front line, that they wanted the best PPE possible. And for infection preventionists, we've always based on the PPE used by the mode of transmission, whether it be contact or droplet or airborne or a combination of one or two of those type of transmission modes. So we would do standard precautions and transmission-based precautions and use PPE, as I said, based on the risk of exposure, based on the pathogen and how that pathogen was being transmitted. With coronavirus, when it first came about, we thought it was more droplet contact. And then we found out that it's possible that it could be airborne transmitted in the scenario of aerosol generating procedures, such as if you're ventilating a patient, when you're intubating or extubating, or if you're doing procedures like bronchoscopies, etc. So those kind of highlighted that another level of personal protective equipment was required. And as the media and the internet and the news became so heavily focused on what was going on the other side of the world, we were seeing that the guidelines that had, for this, you would wear a face shield, a gown, gloves, and then you look at the news and people were in more attire suited to the Ebola virus, which was also going on at that time in Africa, but we were also in the midst of influenza as well. So we had all those three things that kind of connected all at once, to the point where we forgot about Ebola. In my view, that's just my personal opinion. Not that it was forgotten about from a world perspective, but the focus then became coronavirus and what PPE was appropriate. And so when you saw hospitals in Italy and China where they were wearing the full Tyvek or bunny suits, as we call them, and with the head covers and mask over respirator mask underneath PAPRs, and double gloving and gowns and gloves and the shoe covers and boots and so forth. And then you look at what we were recommending based on the CDC guidelines, and staff were saying, wait a minute, that doesn't look right. They're in the middle of the outbreak and you're asking us to wear this. But again, they were at a different stage in the outbreak, or the pandemic, I should say. And with the fear that was growing exponentially, staff were demanding that they too should be wearing a higher level of protection. You know, education was a key component of this outbreak, and really emphasizing how the virus was being transmitted, that it's a novel virus. We're still learning about the virus. And as we learn more, the messaging had to keep changing with the flow of information. And I can tell you, the flow of information was overwhelming. And everyone now had social media and were reading and were really paying attention to what was being published, what was being said, and were challenging what we were saying. It was a very fine balance that we were having to maneuver there. We were on that kind of fine line. But these caregivers were real troopers. They were afraid for themselves, their colleagues, their families, and rightly so, because people were dying. And they wanted to make sure that they were able to come in every day to care for the patient the best way possible, so that each patient would leave to see their own families and to be able to go back to their regular lives. So the PPE piece became a huge piece, even though on that hierarchy of control, upside down triangle, even though it was at the bottom, because the frontline individuals, that's what they were concerned about. What was the right PPE to be worn?
I'd imagine it would have been an absolute bear to manage the information and the education. I know that in my experience, PPE used to be this thing that it was almost like hand hygiene practices where people do them to various degrees of commitment and accuracy and all that. And now PPE was launched into the forefront. I mean, this is an absolute necessity. And I'm imagining people finally like paying attention to how they're putting it on, what order, did they recontaminate themselves, all those things, and improvising and all of that. I imagine all that was going on, right?
Yeah, yes, it was. And I think you're correct. The PPE pre-COVID, we would have to reinforce with staff for this organism. You really should be wearing a gown, and the gown should be donned properly and in this specific order. And I think at that point, because we didn't see people dying if proper PPE weren't being worn per se. And I think with the coronavirus outbreak, and let's face it, a lot of the frontline healthcare workers, some of them, this is their first experience with a pandemic. And people who, like myself, who've been in infection prevention for more years than I care to admit to, have gone through the SARS epidemic back in the early 2000s and have gone through swine flu and H1N1 and so on. So I think for them, this was new to them, to this level anyway, to this level of transmissibility. And the way people were just dying every time, every day, every morning, you would turn on the news or look at the data coming out from various organizations. Another 1,000 died today, another 1,200 died today globally. And then when you start to see those numbers within the United States, it was scary. And rightly so, that these caregivers, healthcare workers at the front line wanted to make sure they were protected to come back and care for their patients another day. So yes, there was some improvisation with PPE because, again, some of that was through fear and some of that was, why not just go for the max? Because I think some of the confusion was when you looked at some of the guidelines making bodies that you count on, when you had a preferred PPE, but if you didn't have that PPE available, this set of PPE would be acceptable. So again, we had to manage the supply of personal protective equipment. We were my hospital, are part of a larger system. And so we had their support as well from a system level and a region level with personal protective equipment. But we were still tasked with managing that supply to make sure that we were able to get through the outbreak or the pandemic, because we didn't know how long it would last. And so we had modifications. For example, OSHA loosened up on some of their requirements, but we were still required, for example, to fit test individuals to ensure that if they were wearing an N95 respirator as part of their PPE attire to care for these patients, that they provided with a good fit so that they weren't just putting on a piece of equipment and then be still at risk for exposure.
Jackie, about that, can I just ask, with fit testing, I'm familiar with that. I mean, that's quite a procedure to go through that. And when you're talking about the potential of reusing these masks, did they institute more frequent fit testing at a larger scale, or what does that look like?
I think, let's step back for a minute. I think as part of any infection prevention program, because we deal with patients who might have tuberculosis or chickenpox or measles, where we use an N95 respirator mask, or physicians who may be doing bronchoscopies might be using a PAPR. So again, when we were looking at this, we felt it was important to continue on with fit testing, because when you look at our stockpiles, we found that some of the N95 respirators were not the ones that we were fit tested on. So we felt it was really important that we fit test. But as we moved through the pandemic, it was to the point when you're being fit tested, you would keep that mask for when you would use it, that initial stages. And with each donning of the mask, the N95 respirator mask, you would be required to do a seal check to ensure that you had a tight seal each time you would put on that mask. And so that was still continuously being part of what we were doing, because we wanted to ensure that the healthcare workers were provided equipment that would keep them safe throughout their shift and throughout the days and weeks to come with this pandemic. And so when we were finding ourselves in a shortage situation, the CDC had a plan as to how we could mitigate those shortages. And so we had 3 phases to that mitigation strategy. And it was the conventional, what we would do pre-COVID, where we had lots of N95, etc. And then contingency, what could we do knowing that we're heading in the area where we may not have enough? And then the crisis mode, where we were down to practically nothing. We moved through those stages fairly, I wouldn't say quickly, but in a successive manner as the number of patients we were seeing increased, where we realized that we couldn't keep throwing away these PPEs, because we were starting to see shortages, not just in my hospital, but within hospitals within the system and the region and across the country. And a big part of that was because some of the masks and respirators were being manufactured in the very location where this pandemic started. And so then that pipeline shut down. And so it had to be managed appropriately so that we would have PPE moving through. So we ended up with new terminologies that were not used before, like limited reuse or extended use, which was based on the concept that if you had a unit where you cohorted all your patients that were known to be positive for coronavirus, then you would extend the use of the PPE, whether it be a respirator or a mask with the face shield, and you would change your gown and gloves as you move from patient to patient. But that again ran the risk that then we could end up in a crisis mode for gloves and gowns. So we had to use a strategy that for the positives, if we were not doing aerosol generating procedures, such as ventilating a patient, then we would use a regular mask and a face shield and, of course, gown and gloves to go and take care of those patients. But then if we were doing those other procedures, those aerosol generating procedures, then you would wear an N95 respirator that was fit tested to meet your needs, or a PAPR, because not everyone can wear an N95. If you've got a lot of facial hair, you can't wear an N95 because you won't get that proper fit. So you would wear a PAPR, and then of course the gown and gloves. But as I said previously, we were monitoring what was happening across the globe, on the other side of the globe, where the PPE that was being worn didn't quite look like what we were wearing. So staff were challenging, like, how come we're just wearing this when you look at that, where people are in Tyvek suits and double masking and head covers and shoe covers and protecting any exposed skin. So we got creative.
Yeah, you're managing expectations and the supplies and the information that's constantly coming in. I mean, that's a tall order, and I can totally picture staff questioning those very things. Are you starting to see anything improving in terms of supply chain and staff's understanding and all that? Is that getting better?
I'd like to be optimistic and say that yes, it's getting better. But I think what makes me say that, if we take, for example, the N95 respirators, we've reused those respirators and for long periods of time and then discard them and then use a new respirator. But now we've gone to the point now where we are reprocessing respirators that were not initially designed to do that. But I think with the collaboration of the manufacturers of the respirators and companies that manufactured sterilization equipment, that we were able to, quote unquote, validate the reuse or the reprocessing of those respirators through testing. And with the CDC NIOSH testing samples from stockpiles at the federal level, at the state level, and local levels to see if masks were expired, would they still function in the same way? So not only were we using masks, some of them which may be expired, but now masks that were possibly expired that are now being reprocessed in a variety of ways, whether it be through vaporized hydrogen peroxide or through ethylene oxide or ultraviolet radiation. And so those were some new concepts and constructs for us in infection prevention that we never experienced before. And so as we move through this pandemic, I would like to say that yes, the supplies are getting better, but we're constantly vigilant in monitoring those supplies to ensure that we don't get too excited that yes, with supplies are getting better, but we still being responsible users of those supplies with what we've got.
Yeah. So, what are your thoughts then, do you think, going forward, like lessons learned from this with PPE? It's hard to kind of look on the other side of this pandemic since we're still in it. But I'm just wondering, as we go through it, there must be some things you're already thinking on a long term. Is there anything special, ICU, ER, anything like that? Anything specific to them?
There's a question I ask myself every single day as an infection preventionist. What did we do in the past? What we're doing now, and what are we going to do when we're hopefully beyond this pandemic? Because I think right now, the impact, not just on healthcare facilities, but on the general population and the economy and all these things are really driving how we move forward. So I think it's really behooves us that we do not go back to business as usual, because in my opinion, this is probably going to be one of many pandemics to come, unfortunately. And I think a big part of that is the personal protective equipment. And what role do manufacturers play in the grand scheme of things, and how we manage supplies, not just in the healthcare facility, but also at the manufactured level. I don't know if manufacturers stockpile over and above what they provide to their customers. I don't know that. So when you look at the way diseases are transmitted, that I think we need to have personal protective equipment that, number one, are tested to provide barrier protection. Because, for example, like you see some of the head covers that are worn in the operating room and shoe covers, and they are not tested to be barrier equipment. They're tested to keep things from falling into surgical wounds. and or to keep your shoes clean if you're being exposed to a lot of blood and other body fluids. So I think we need to look at how these products are manufactured, how they're tested, because, some of these products, they're only providing protection in what's referred to as the critical zones, the elbow to the wrist and the front of the gown. But when you're in infection prevention, isolation gowns, they need to provide protection 360 degrees and be coverage all across the back and the front. And I think one of the key things for me that came out of this, even though there has been no documentation that I'm aware of at this point, that if you get it on your skin, you can transmit disease that way. But again, it's not to say that it can't happen if you touch that particular body part and then you touch your eyes, nose, and mouth, that you couldn't transmit a virus like coronavirus. So again, I think the way we design these gowns, we really need to go to our customers and ask them, what has this pandemic taught you about the personal protective equipment that is being worn currently? And how should they be designed to deal with the pandemic as we move through the summer and into the fall, when influenza comes around again on top of the coronavirus, which the expectation is that it'll be a surge again when the flu season starts. While we're in this point in time, I think manufacturers of these products really need to be discussing with their customers their experience to date with PPE use at the front line and what things they felt were gaps or shortcomings that needs to be filled with regard to the use of respirators and masks, because now we're into using cloth masks. And in an effort to protect the masks that we have and the respirators that we have, we are double masking or wearing a face shield to protect those masks while doing any kind of direct care. So I think a lot has to change from the manufacturer's perspective as well as from the healthcare perspective, the way we prepare, the way we educate our front line, and the way we manage supplies and expectation, as you so rightly put it earlier. So it needs to be addressed based on the procedure types and the risk, because we know that some of these PPE aren't exactly designed for some of the things that it's being used for currently. And we've moved through supplies very quickly.
That's great, Jackie. I think those are fantastic insights. I think just that you laid it out for us, that basically we can't go back to business as usual, and there's got to be some changes, obviously, on the manufacturer side, on the planning and implementation side for those who are in the hospitals, and also for the education. And it should never go back to business as usual after this. We should probably forever be impacted by this and hopefully be better prepared for the next go around, right?
Yeah, we have to be better stewards for the products that we're using, because when you asked about what's happening in the ED and the ICU and in the operating room, I mean, if a COVID positive patient needs to go to the operating room, we might be using respirators that weren't designed to be used in that particular environment. Because one of the key things that stood out for me in this pandemic is the generosity of the community with donating masks, a wide variety of masks, people sewing masks and providing it for the caregivers, because we're really concerned for the safety of those working at the front line. And so we had a variety of products that were being brought into the organization, and we had to vet those to make sure that they met the standards for those working at the bedsides, for those working in the OR, in the intensive care units, in the emergency room, while, again, as I said, be good stewards of those personal protective equipment. We've even had manufacturers Now say, we're going to stop what we normally do and we're going to make you face shields. We had people who were using 3D printers making face shields as an example. And then the move to universal masking, where everyone is wearing a mask, that eats up supplies as well. And I think from that perspective, we seem to be holding our own. But I think where it's still a little bit tenuous is related to like the N95 respirator mask and the variety of them that are out there, because with the shortages, we've had a variety of them come in, full face respirators, the valve respirators. It was a matter of ensuring those were appropriate for the settings that they would be used in. There's a lot of learning still to come and a lot of work that needs to be done from the learning so far to help move us forward so that we're better prepared from the standpoint. Like when you look at masks and you see the way they wear the mask under the chin and they're not covering quite their nose, and it's not, those items were not designed to be worn long term. It becomes challenging when you see the visuals on the news of what's happening to the face of the healthcare worker, not just there, but also in our facility as well. And they weren't designed for that long-term wear. So the design of those masks need to be also looked at to see how can we make them better, make them more comfortable for those that have to wear them for long periods of time.
Jackie, lots of great insights. You're really giving us a lot to think about, and manufacturers and healthcare workers alike, infection preventionists, all of us have a lot to think about, have a lot to work on. And you're right. I remember those lots of pictures of healthcare worker faces that are just bruised up and kind of beaten down, even just from wearing PPE, which is something that, I mean, you would have never even thought of before.
Yeah. And even with the reprocessing, you look at sterile processing departments, that's a new competency for them, that they're reprocessing N95 respirators, which they could do at this time because, again, we've had restrictions on elective procedures and hospital volumes have gone down during this pandemic to date. And as we try and ramp up, we have to be, again, good stewards of PPE, especially when it comes to the operating room, because in order to provide surgical services, they need to be properly protected as well. The supply shortages, the supply chain, we need to find a better way of how we manage it and how we supply our customers. So there's lots of learnings so far, but there's still lots of learnings to be had.
Jackie, it's been a pleasure. I want to be respectful of your time. I could probably talk to you for a lot longer about this stuff, and there's probably a lot more to come as time goes on. But really, I appreciate everything you do, your team, and all the other infection preventionists working hard to try and get us through to the other side of this pandemic. So thank you for joining me tonight.
And I thank you as well. And for my colleagues out there, we're all in this together. And I know that has become the mantra for this pandemic, is that we're all in this together. But if I may leave with just one parting comment, is that the manufacturers of PPE need to reach out to their customers and say, what do you need moving forward with this pandemic or the next pandemic? Share your experience with us and let us know how we can better serve you as manufacturers and help you be stewards of the PPE that you have to bring you through, so we don't have to go through what we're currently going through right now in this pandemic. So thanks very much for this opportunity.
That wraps up our interview with infection preventionist Jackie Daley. She shared with us her experience and some lessons learned from managing the COVID-19 pandemic. She also shared with us some of her thoughts on the future of PPE and what manufacturers can do to better serve the needs of the customers. I hope you enjoyed this episode. If you haven't already, please subscribe to the podcast. You can subscribe through Apple Podcasts, Google Podcasts, Spotify, Stitcher, and more. Thanks again for listening. All opinions expressed on this show are those of the presenters. Before using any medical device, it is important to review the device manufacturer's instructions for use.